Dr. Marvin, good afternoon.
John, good afternoon. As always, you are a pleasure to deal with.
Well, this isn't a pleasurable topic. The ooze, exudate. What the heck is it?
Well, it's very, very, very frequently misdiagnosed. Number one, they're little blisters from the steroids, often on the face. And I've seen probably 200 to 250 patients who have been misdiagnosed. The doctor's calling it herpes. We did have a little segment on herpes. They are not herpes blisters. If you had herpes all over your face, it would go internal. It would affect the liver, the brain, the kidney, everywhere. You would not survive. So, sorry for the intrusion. She wants to get on film also.
I got it.
The steroids closes blood vessels down, then they dilate because they have a job to do in the skin, and there's a pouring out of fluid from the slightly damaged vessel walls. Either it goes internally and you get edematous and swollen, the legs, the face, when you lie down at night, you wake up in the morning, you get a puffy face, or it comes out of the skin and they get little tiny blisters, or after a little scratching, the water starts showing from the pathology, which when you do a biopsy, there is fluid between the cells in the epidermis. It's called spongiosis. Sponge. There's the fluid. It's normal body fluid caused by the steroids. And then as the patient gets better after several months into withdrawal, this stops.
So this edema and this oozing is not, for the whole course of the withdrawal. Is that
No,
correct?
it's very early. Oh, and also forget the herpes being the major misdiagnosis, but very frequently the color of the fluid is a little yellowish or even just clear, and the doctors say it's infected and it puts them on antibiotics. And when the blisters don't go away and the fluid doesn't seal itself in 7 days or 10 days, they give them another bout of antibiotics. And it's just misdiagnosis.
What's the determinant physiologically, and this may be an unknown, of whether the fluid leaves the body as ooze or stays in the body as edema? What is that traffic cop?
I have no answer to that. I have never been able to answer whether it's because they were put on prednisone or they got a shot of Kenalog, maybe that forces it internally versus externally, or they use a super potent steroid versus a middle strength one. I have no concept. It's so confusing because they come to me having used so much in order to get better that it's difficult to separate out what a factor might have been. It just happens. Most of the oozing people have a little edema. Most of the severely edematous people have a little ooze. It goes hand in hand.
Perfect. Let's leave it there. Please like, share, and subscribe.